Your Excellency, Dr. Maryam Al-Misnad, Minister of State for International Cooperation at Qatar's Ministry of Foreign Affairs, Excellencies, distinguished guests, ladies and gentlemen, Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Hana Shihabi, Research Assistant at the Middle East Council on Global Affairs. And on behalf of the Middle East Council and the Gates Foundation, it is my pleasure to warmly welcome you to the closing plenary of the second annual convening of the Doha Global South Health Policy Initiative. We would also like to extend our sincere gratitude to Qatar's Ministry of Foreign Affairs and the Ministry of Education and Higher Education for their continued invaluable support on this important initiative. Over the past 3 days, this convening brought together senior health officials, policymakers, and experts from across the Global South, alongside representatives from Qatari institutions and international partners, with the shared goal of strengthening South-South exchanges, technical cooperation, and collaborative action to address our most pressing health challenges. And we are pleased to extend this critical dialogue with you all today. Today's panel discussion is titled Reimagining Global Health Financing, Prioritization and Integration in the Global South. It will explore the growing challenges in accessing development financing in public health and highlight opportunities to enhance resource mobilization, harnessing stronger cooperation, and establishing adaptable and innovative solutions. And with that, I am honored to invite Her Excellency, Dr. Maryam Al-Misnad, Minister of State for International Cooperation at Qatar's Ministry of Foreign Affairs, to the stage to deliver opening remarks.
بسم الله الرحمن الرحيم. الحضور الكريم، السلام عليكم ورحمة الله وبركاته. يسعدني أن أكون بينكم في هذا اللقاء الذي يجمعنا على رؤية إنسانية مشتركة، وأن الصحة ليست امتيازاً تمنحه الدول بل حق أصيل لكل إنسان، وأن العدالة الصحية هي الطريق نحو تنمية مستدامة وسلام دائم. عندما دعمت دولة قطر إطلاق هذه المبادرة كان ذلك من إيمانها العميق بأن بلدان الجنوب العالمي يجب أن تكون شريكة في صياغة السياسات، لا مجرد متلقية لها، وأن تمتلك أدواتها وصوتها في بناء مستقبل صحي أكثر إنصافاً واستدامة. وأظهرت النقاشات في العام الماضي أن التفاوت في الوصول إلى الرعاية الصحية لا يزال من أكبر التحديات بالنسبة للنساء والفتيات والفئات الهشة، وفي كثير من الدول لا تزال الوقاية والتوعية في آخر الأولويات، رغم أنها الأساس لإنقاذ الأرواح وحماية المجتمعات. نؤمن في دولة قطر أن الصحة تبدأ من الإنسان والتعليم والبيئة التي يعيش فيها، فالنظام الصحي المتين لا يبنى بالمستشفيات فقط، بل بثقافة وقائية وعدالة في الفرص واستثمار في الكوادر المؤهلة. الصحة ليست خدمة تقدم، بل كرامة تصان، وهي حجر الأساس لكل مشروع تنموي وإنساني. على المستوى الوطني أطلقت دولة قطر الاستراتيجية الوطنية للصحة 2024-2030 بقيادة معالي رئيس مجلس الوزراء، لتكون خريطة طريق نحو نظام صحي متكامل يضع الإنسان في قلب التنمية، ويركز على الوقاية قبل العلاج، والابتكار قبل التحدي، والعدالة قبل الامتياز. هذه الاستراتيجية لا تهدف فقط إلى تحسين الخدمات، بل إلى بناء منظومة صحية قادرة على الصمود، تستثمر في الكفاءات الوطنية وتدمج التكنولوجيا والبحث العلمي لخدمة كل من يعيش على أرض قطر. وعلى المستوى الدولي تواصل قطر أداء دورها الإنساني كجسر للتضامن بين الشعوب، فقد قدم صندوق قطر للتنمية أكثر من $1 مليار لدعم الرعاية الصحية في أكثر من 50 دولة، في بناء المستشفيات والمراكز الصحية، وإلى توفير اللقاحات والأدوية، وتمويل وبرامج مكافحة الأوبئة، ودعم اللاجئين والمجتمعات المتضررة. في أفغانستان دعمت قطر خدمات صحة الأم والطفل في أكثر المناطق احتياجاً، وفي باكستان مولت عيادات متنقلة لخدمات مئات الآلاف من المتضررين بالفيضانات. وفي اليمن والأردن ساهمت في تحسين المياه والصرف الصحي وتشغيل عيادات اللاجئين، كما أطلقت مبادرات مشتركة مع منظمة الصحة العالمية واليونيسف والتحالف العالمي للقاحات لتعزيز التأهب الصحي ولبناء القدرات. هذه الجهود ليست مجرد دعم مالي، بل تجسيد لرؤية قيادتنا الرشيدة التي تؤمن بأن الاستثمار في صحة الإنسان هو استثمار في كرامته وفي استقرار مجتمعه وسلامته. إن الأزمات الصحية المتكررة من الجوائح إلى النزاعات أثبتت أن لا أحد في أمان ما لم نكن جميعاً آمنين. لذلك تدعو دولة قطر إلى تعاون دولي صادق وتبادل الخبرات وبناء أنظمة مرنة قادرة على الاستجابة والتعافي بحيث لا يترك أي إنسان خلف الركب. ختاماً، إن ما يجمعنا اليوم هو إيماننا بأن الصحة ليست رقماً في تقرير، بل مقياس لإنسانيتنا في حياة كل من ننقذها، وكل مجتمع نساعده على التعافي هو خطوة نحو عالم أكثر عدلاً وإنصافاً. ودولة قطر ستظل على عهدها تدعم كل جهد يجعل من الإنسان محور السياسة وغاية للتنمية. وشكراً لكم.
Thank you, Your Excellency, for your continued dedication to international cooperation and global health equity. With that, I am honored to invite our Executive Director, Dr. Khalid Al-Jaber, to the stage to deliver welcoming remarks.
Good evening, everyone. Assalamu alaikum wa rahmatullahi wa barakatuh. سعادة الدكتورة مريم بنت علي بن ناصر المسند وزير التعاون الدولي بوزارة الخارجية، أصحاب السعادة، السيدات والسادة الأفاضل، يسعدني ويشرفني أن أرحب بكم في هذا اللقاء الذي يجمعنا اليوم في إطار مبادرة الدوحة بشأن السياسة الصحية في الجنوب العالمي. مبادرة ولدت من إيمان عميق بأن الصحة ليست امتياز بل حقا إنسانيا أصيلا، وأن ازدهار أي أمة يبدأ من سلامة الفرد والمجتمع. إن اجتماعنا هذا ليست مجرد مناسبة رسمية، بل هو لحظة إنسانية خالصة نلتقي فيها على قيم تجمعنا، إنها الرحمة والمسؤولية والإيمان بقدرتنا على بناء عالم أكثر عدلا وإنصافا. وأود من هنا نعبر عن عميق الامتنان والتقدير لوزارة التربية والتعليم العالي، ولسعادة السيدة لولو بن راشد الخاطر التي بدأت هذه المبادرة، والتي تكملها سعادة الدكتورة مريم المسند، وعلى الدعم الصادق ورؤيتهم الثاقبة اللتين تجسدان التزام قطر الثابت بالاستثمار في الإنسان تعليما وصحة وتنمية. كما أتوجه بخالص الشكر إلى شركائنا الكرام مؤسسة جيتس وصندوق قطر للتنمية، وإلى كل المؤسسات والخبراء الذين نذروا وقتهم وجهدهم في سبيل هدف سام يتجاوز الحدود والسياسات ليصل إلى قلب الإنسان أينما كان. في هذا العام بدأ مؤتمرنا التقني غني بالتجارب والرؤى، ركز على تحديد الأولويات وتعزيز التكامل، واتخذ من التحصين مثالا حيا على ما يمكن تحقيقه حتى حين تتضافر الجهود وتتوجه بالحكمة. تلت ذلك ورش عمل بالتعاون مع معهد الجزيرة الإعلام، ونقدم لهم الشكر أيضا على تعاونهم معنا، ركزت على مهارة التواصل الفعال، لأن الحديث عن الصحة هو في جوهره أيضا عن الإنسان والأمل في الحياة نفسها. أما جلستنا اليوم فستتحدث عن إعادة تصور تمويل الصحة العالمية، وهو تعبير صادق عن السعي المشترك نحو نظم صحية أكثر استدامة وإنصاف، في وقت تشهد فيه دول الجنوب تحولات عميقة في سبل تمويل القطاع الصحي. علينا جميعا أن نضع الإنسان في صميم كل نقاش، وأن نحرص أن لا يترك أحد خلف الركب، وأن نصل ثمار التنمية إلى كل بيت وقرية ومدينة. إن مجلس الشرق الأوسط للشؤون الدولية يرى في مبادرة الدوحة أكثر من مجرد منصة للحوار، إنها رسالة إنسانية صادقة وجسر محبة وتعاون ما بين الجنوب العالمي والشرق الأوسط وسائر مناطق العالم. رسالة تؤكد أن السياسات الأكثر فعالية هي تلك التي تبنى على الرحمة والمعرفة والشراكة الصادقة. شكرا لكم جميعا على حضوركم وعلى التزامكم بروح التعاون التي تجمعنا اليوم، ونسأل الله أن يجعل من حوارنا هذه بذرة أمل تثمر تعاونا دائما وإنجازات تخفف معاناة الناس وتمنحهم حياة أكثر كرامة وعدلا وصحة. شكرا لكم.
Thank you, Dr. Khalid, for highlighting the role of dialogue and joint action in fostering policy solutions. I'm now delighted to welcome our panelists and moderator to the stage. We're joined today by Dr. Teresa Madbuko. She is the lead of the Doha Global South Health Policy Initiative, and she will also be moderating our discussion today. Dr. Teresa, please. We are also joined by Sheikha Haya Al Thani, Deputy Director General of the Planning Sector at the Qatar Fund for Development. Please. And Mrs. Magdalena Robert, Deputy Director of Program Advocacy and Communications at the Gates Foundation. And last but not least, we have Dr. Mui Aina, Executive Director of Nigeria's National Primary Healthcare Development Agency. Enjoy the panel, and I hope it's a fruitful discussion. Thank you.
Good evening, distinguished ladies and gentlemen. As Hannah's nicely said, my name is Teresa Madbuko, and I'm the lead at the Doha Global South Health Policy Initiative with the Middle East Council on Global Affairs. So it's my honor to be moderating this distinguished panel today on reimagining global health, financing, prioritization, and integration in the Global South. I welcome you all to this high-level discussion, and I believe it comes, and I'm sure you'll agree with me, that it comes at a time when major reductions have come about in the development assistance, which are reshaping how countries sustain essential health services. And so this discussion today is both urgent and very, very timely. Today, we've brought a very distinguished panel that are very knowledgeable on this subject of health financing, to begin to reflect on how countries can protect frontline services, adapt their delivery models, and mobilize sustainable financing. Our aim today is not only to understand the challenges, but also to identify pathways and some solutions through partnerships, South-South collaboration, to begin to ensure continuity of care and to strengthen country ownership in this shifting landscape. With me on the panel today, we have Sheikha Haya Al Thani, who is the Deputy Director General of the Planning Sector, Qatar Fund for Development. She has previously served as the Director of Strategic Partnership at Qatar Fund for Development, and she has a wealth of experience in high-level government offices, overseeing stakeholder engagement, strategic partnership, robust management, and stakeholder engagement portfolio, facilitating successful delivery of various projects on a national level, and she has also served at the Ministry of Foreign Affairs and the Ministry of Defense. Can we have a round of applause for her, please? Yeah. We also have Ms. Magdalena Roberts, Magda, as she's popularly known. She's the Deputy Director, Program Advocacy and Communications with the Gates Foundation. She leads a team that works to increase political commitment and funding for immunization, polio, pneumonia, enteric and diarrheal diseases, and neglected tropical diseases. She's a lady that never pauses, never rests, is always moving, always dynamic. She has previously served as Senior Program Officer for Immunization Advocacy and supported the Foundation's Multilateral Partnerships team. Before joining the Gates Foundation in 2016, she worked for over 20 years across the UN, civil society, academia, government, and the private sector. And last but not least, we have Dr. Mui Aina, who is the Executive Director and CEO of the National Primary Healthcare Development Agency, Nigeria. He is here to share from his over 25 years of experience in healthcare leadership, research, development. He leads and he has led national reforms to strengthen primary healthcare systems, expand immunization, improve maternal and child health outcomes. Previously, he served as the founding CEO of the Solina Center for International Development and Research. You're all welcome to the panel. So we move immediately into the questions. And the first question goes to you, Dr. Aina, as our gentleman on the panel today. So, Nigeria has faced major fiscal pressures while maintaining large-scale programs like immunization and primary health care. How has Nigeria faced this challenge, and what can other countries learn from this experience?
Thank you very much, and good evening, Honorable Minister, Your Excellency, other excellencies seated, and colleagues. It's a pleasure to be here, and thanks to the Council and the Ministries of Education and Higher Education, as well as Foreign Affairs, for putting this together. I think for us in Nigeria, this situation of the shift in ODA landscape really met us in an interesting place. Interesting in some unfortunate way, but also in some fortunate way. Unfortunate in that we already had a financing problem, even with status quo, a substantial one, that when the government came in about 2 years ago, it was very obvious to us that, between what the government was spending at all levels and what the donors were giving to the country, we were just around $20 per person for a country that has a very large, very young population, that has underinvested in the health systems for decades, so that we had dilapidated infrastructure, we had inadequate health workers, and just gaps across board. We already had a problem. So we already started to put things in place to try to figure out ways to, one, increase domestic financing, and also to drive efficiency within the health sector. So at the height of that was the minister has put in place a sector-wide approach to really organizing the resources that we have. First of all, whether it's government at every level, whether it is donors that are bringing money, to structure it around our priorities. You cannot solve everything in a few years when you have a lot of problems and you have very limited resources. So the president, in fact, had signed a compact with the states that prioritize maternal and newborn health, immunization, and the quality of primary healthcare services, among a few other priorities. So it was obvious to us that, to stretch the resources that you have, first of all, you need to move very quickly towards integration. So at the primary healthcare level, it used to be that, we have 30,000 plus primary health centers. And if a woman is pregnant, for example, there's a subset of primary health centers that you could get antenatal care. When you want to get nutrition services in pregnancy, you went to our nutrition centers that were very different. Then when you wanted to have a baby, you wanted to have PMTCT and other interventions, you went to a different subset of facilities. That was inefficient. We also didn't have enough workers or equipment to go around. So it was very clear to us that we needed to consolidate and integrate. So we started to think about integrated primary healthcare services. Drove very quickly towards prioritizing the PHCs, primary health centers, around geographic spread and access, because we did an analysis that showed us that, in fact, population matters, but really it's a distance to the facility that was most directly correlated to the outcomes that we were getting. So we prioritized based on, one fully functional facility per ward, and started to drive investments in health workers, in equipment, and in infrastructure, and that's in progress now. The other thing that we did as well is for services like immunization, where we were having multiple campaigns, we decided we needed to integrate, because again, to optimize our resources, we needed to pull them together. And in fact, this week, we're in the second week of a very large, important health campaign that incorporates the measles rubella vaccine with the human papillomavirus, other routine vaccines, nutritional services, malaria chemoprophylaxis, malaria prevention, and many other things. And we're hoping to reach 106 million people in that intervention alone. What we are doing there is we're sharing resources for advocacy and communications. We're sharing resources for service delivery. We're sharing supply chain infrastructure. So that's also helping us to achieve some efficiency. But in addition to this, we of course need to increase fiscal resources. So there's been substantial engagement at that. We have 3 tiers of government. We have the federal government, we have the state, we have the local governments. And most of the cash that is injected into the health sector really used to come from the federal level. The states participate, but most of that is in kind, through health workers and through operation of facilities and all. So we decided to do 2 things. One is to increase the amount of resources that the federal government is putting into primary health care. So we currently have 1% of our consolidated revenue fund that goes into a pool called the Basic Healthcare Provision Fund, which is the major fund that goes through the federal government, multiple gateways to the health facilities. So we're asking that the federal government, and there's already a draft bill in the legislature now that is being reviewed to increase that to 2%. It's not going to be enough, but it doubles that amount of money when it gets done. We're also creating incentives for the states to more participate with cash, to match that with their own resources, in the Basic Healthcare Provision Fund. The other thing that we're also dealing with is the reliability of release, because as some of you will know, in many of our countries, you can have a budget and then the cash flow to back it up may take a little bit of time. So we have also moved upstream to say before the funds are distributed between the federal and the state governments, what can we take the deductions from there. There are innovative financing mechanisms as well that we have looked at. So additional taxes, sin taxes, the VAT pool that we're in advanced stages of discussions with the negotiation, because the money is jointly owned by the federal government and the state government to try to pull resources out of that. Of course, we continue to engage with our partners, many of whom are also going through a difficult time. Those that are replenishing funds, those that are trying to raise money. We continue to engage to see how we can get the most that we can, but also structure them the best way that allows us to optimize it, especially using government systems in a way that is lower cost and more sustainable. Thank you.
Thank you very much for sharing. So some of the things that Dr. Muyi has highlighted is the importance of integration, importance of speed, and also the importance of partnerships. And I think I'd like to then move to the Gates Foundation to ask Magda, given the sharp reductions in traditional development assistance, how is the Gates Foundation rethinking its approach to health financing, especially in the Global South?
So first of all, on behalf of the Gates Foundation, please allow me to thank everyone here. Government Qatar, Your Excellencies, thank you so much for what you do in the social sector for the people of this world. To the Middle East Council, thank you so much for convening. To those country partners like Muyi and many others in the floor, we have had tremendous insightful dialogues in the last few days. So really thank you for enable us to create this space, to move our thinking, and really share some of the experiences as we move forward. I have to say a special thanks to Al Jazeera. We came a little less knowledgeable about what communications meant, the importance of communications. We had 2 very intense days of training, and what you're sharing with us, I think, will be very impactful as we move forward. So from the Gates Foundation, we are, of course, deeply concerned by the trends in ODA. We know that there are reductions happening at this moment in time. We know that these reductions could be impactful of the progress that we built over the 20 years. I remember, for instance, Qatar was very influential in bringing some of the work on the MDGs on education. We were also in the Gates Foundation, mostly on the health sector. When we started to build the SDGs, we were building a future for better lives, better well-being of all. Cuts could derail that progress. And it's progress that we built over years, over decades, that if we're not able to sustain our investments, we could derail some of that progress, and it will take us decades to rebuild. So from the Gates Foundation, you might have heard our leader, Bill Gates, recently announced his commitment to increase his funding, to increase his vision, because he's committed to reducing maternal child mortality again. He's committed to the elimination agenda that many of you are part of. You can't hear me? My apologies. So he's also committed, and we at the Gates Foundation, to the elimination agenda, whether it's eradication of polio, and we work with you closely on that. We've learned a lot from Nigeria, we learned a lot from DRC, from Pakistan, and from Afghanistan, on what it really means to do a partnership as we move forward. So we are thankful also to the government of Qatar, because you have not wavered. We are helpful for the partnership, and we do hope to find alternative sources of financing. And we've heard in the past few days from many of our colleagues from the country how they're looking to a little bit what the transition that Mui was sharing with you of that sustainability, the cost effectiveness. I think if you listen to the countries, you will be inspired by what we hear and their innovative solutions, but they still need our help, so let's not waver.
Thank you very much. And I think that's a good lead then into my question to you, Sheikha Haya. Qatar Fund for Development has been instrumental in forging partnerships that channel resources into health and development. How is the Qatar Fund for Development engaging with the Global South partners to ensure that funding priorities align with country-defined needs and not external agendas?
That's quite a layered question that you sent my way, but I would echo first my fellow panelists in thanking our hosts and thanking, of course, the Minister of Foreign Affairs, the Minister of Education, for the concerted effort in bringing this to life and to, advancing it forward. And we're happy with the small role that Qatar Fund for Development has played in progressing this along. I would say that the panelists here demonstrate a lot of what the themes I would like to highlight, which is that Qatar Fund for Development is the developmental arm of the State of Qatar globally. But we work with our partners. The Gates Foundation is among the leading partners, but we also work with country partners to advance these agendas in a way that is compatible with the needs of the country. It's very difficult to, enter a country and define those needs if not there is the buy-in and the sort of support of the government itself. And we talk a lot about ownership. No one wants to forego ownership of their own country or their own interests. No one wants to give that over to a developmental agency or another influence, external influence. Everyone wants that, but the issue usually is resources or the knowledge base to be able to integrate effectively. And most governments want the best for their country. And so sometimes those, that agency is given to others because they believe that it's in the best interest of their country. And the State of Qatar believes that any developmental project or any humanitarian assistance, even for that matter, has to be through the country itself, the recipient, taking lead and ownership of it. And that's why at Qatar Fund for Development, any engagement we do with development, in our development portfolio or in humanitarian assistance, has to be through the government, but also weaved into their own national plans. We heard of the very integrated approach to countries like Nigeria and the like of how they approach things, and that relationship between the ministry itself, but the financial mechanisms and then the facilities are things that that knowledge base will never be known to countries or agencies that operate globally. It has to be rooted in the country itself. So that's on one level. Another level that we work with is, of course, our partners. You know, our partners lead our global and humanitarian assistance. And at Qatar Fund for Development, we do something quite well, which it's to the credit of our partners, but we pick our partners well, and we pick those who do the best globally, and we support them in ways that we believe are best for the interest of the partner, but also for the delivery of the project. One of the ways that we do that is that we approach them with a multi-year commitment. We don't look at projects as ad hoc or with a quick turnover. We really do look at projects in the long term. And we also we're operating off of our own strategy. And that strategy is composed of course, the sectors of focus. So we have our educational sector, our healthcare, and economic reform. But under that, there are multiple subsectors that feed into our approaches and our interactions with governments and with our projects globally. So I think that's in some how we approach things, but of course there are a lot of nuances to the approach that I'm happy to discuss later.
Thank you very much. I mean, while we still remain on country ownership and how we can sort of make sure that dependency is not created, but that countries are actually strengthened, then I'd actually like to then ask you, Magda, how can philanthropy ensure that support does not create this dependency, but instead strengthens country-led priorities and sustainable financing models and help countries to achieve more with fewer resources?
So the ultimate responsibility is with the governments, and people like Mui, his leadership, others that are in the audience, they're showing us the way. They know what is needed, they have their plans, and we as the Gates Foundation need to abide, and I think you do the same in Qatar, that is those national plans that we need to emulate. We know that philanthropic dollars cannot replace to the same level that other development assistance dollars or euros or pounds or whatever. But we know that our funding can be a little bit more risky. We know that we can invest, for instance, at the Gates Foundation, we're a unique institution. We do invest quite a lot on research and development. These are things that might not be have the risk appetite of many of the member states, but we do that risk investment, so when we have solutions, they can be scaled, rolled out. For instance, one of the things that we, and because we mentioned the cervical cancer, the human papilloma vaccine, this is one thing that, 15 years ago, it needed 3 doses. Recently, it was 2 doses, and about a year and a half ago, we worked with some countries to show the efficacy of vaccine, and the studies show that 1 dose was sufficient. So all of a sudden, you are able to show that that technology is highly effective, but you start to bring the cost reductions, there's less shots for girls, it becomes more acceptable, it's a vaccine that cures cancer or prevents cancer. We don't have many of those examples. So we're doing now the same, for instance, with the PCV vaccine for pneumonia. We are looking at a recommendation that it might be enough to have 1+1 dose as opposed to the more doses that you had before. So these are small changes, for instance, that we're investing in studies. At the same time, we are investing in other partnerships, like our work with polio. We know that we can't do this alone. So that's why we work with WHO, with UNICEF, with the CDC and countries, as well as the Rotarians, to create a special partnership. And that is what has enabled us to maybe move a needle on an eradication agenda that could not be possible otherwise. Finally, I think you have heard me mention before, Bill Gates does aim to accelerate our progress. So I think this is when we need partners that come with us in this journey and might be able to take that baton in 20 years when the Gates Foundation is not there, because you do need to bring new partners to the table. I think another thing for us that is really important is to be current. The world of what we envisaged 20 years ago, where there was no information that could be reached everywhere, that has changed. So learning from the experiences of Al Jazeera, how you're shaping the world, how you share information, those are things that we're all constantly looking to innovate and move forward. But again, let me just say, the responsibility of these countries, We need to follow their lead. We need to adapt. We need to be flexible because ultimately they're there to look for the well-being of their people.
Thank you for sharing. And I like those words. Ultimately, the responsibility is on the country. So we look at Dr. Muyi and then we ask him, please, you've already started to share, all the good things that Nigeria has been doing, the sector-wide approach, the integration strategies, prioritization. So could you please share any innovations in service delivery or service integration that have been applied in Nigeria that are showing the greatest promise for sustaining essential services?
Okay, so I think one of the ones that I already mentioned is in the health campaign effectiveness. One of the things that we used to do a lot of is lots and lots of community campaigns because we had a weak health facility network. So we needed to deploy lots of community health workers to go house to house every other week to deliver something in the homes. And what was happening was, in fact, that drew out the little capacity that we have within the facility to make that happen. But it also was a drag, was really stressful for the recipients, for the mothers and the babies who had to give up on their businesses, had to give up on their childcare many times to participate in this program. So really looking at ways to, which Nigeria is in many regards kind of at the forefront of the integration of health campaigns that cut across not just immunization, polio and non-polio, but nutrition, in many instances, in many cases, even maternal care, even NTDs. So there's some neglected tropical diseases where we still have clusters of high burden, and we have certain parts in Kano State in this campaign, for example, that are administering treatment for onchocerciasis and trachoma, as part of this intervention. So that's one element. I think at the core of it, and you can think of it as an innovation or not, is what we christened at the beginning as basically going back to the basics of primary healthcare, where you think about our service delivery, the unit of service delivery is the human-centered approach, where, a mother comes, a child is brought in, you can really take care of their comprehensive set of needs. It's not verticalized programs. On the recipient side, but also on the supply side, when you have 3 or 4 midwives in a facility, then you can't have the immunization specialist and the tuberculosis specialist, and they need to know all of what they are able to do. So in our training bit, we moved from verticalized programmatic training to an integrated primary healthcare training, which we have now digitized and are going to be rolling out, e-learning for all of these health workers. In terms of our supply chain and commodities, we're doing a better job of integrating them so that when you receive a bundle, you're not engaging with multiple programs as a health facility manager, but you're engaging with your drug management agency, for example, for your commodities. And what we're saying is all of the commodities can come from different interventions and different sources, but they get aggregated pre the facility level. So that as a facility, you're thinking about how many patients do I have, how many things do I need, and how do I get them. So that's another thing that we're doing. And we're working with our partners as well, who have historically supported specific interventions and programs to collaborate more. So as part of the sector-wide approach, we have one plan where at a national level, we ask you, what do you bring in? This is our plan. Which of it can you fulfill? And if it's not enough, if you need some wraparound services, that's fine. We do the job of either mobilizing government resources to complement that or bring in other partners that are able to provide complementary funds so that when you do go to the front line, it's integrated. One of the other things that is really helping our integration agenda is the community health worker program. We are reintroducing now an organized community health worker program where local governments and states are hiring these people, often women. They are equipped with digital tools. They have a line list of their catchment area. We basically are assigning households to them, and you know who's where, what's their age, what are their healthcare needs, and you are able to, track these people, check when they have been able to access services and when they're falling out. You have that information, and if it's within your capability, you address it in the front line. If it's not, you refer them and follow up to make sure they come to the facilities. So these are some of the things that we have been doing to try to drive the integration agenda for efficiency, frankly, but also just for sustainability.
Thank you. And that brings me to you, Sheikh Haya. We've been hearing of the importance of collaboration, the importance of partnerships, and you also shared with us that when the Qatar Fund for Development does invest in countries, that you do this for long-term projects, which I think is essential, especially if we're discussing sustainability. I'd really like to ask you, what role do you see for the Qatar Fund for Development? What role does, the Qatar Fund for Development see for Gulf donors in advancing these, some of these sustainable financing models that we've been talking about that go beyond traditional aid?
You know, being a Gulf donor ourselves, we are fortunate to be from a region that really values development globally. We come from a region that's quite susceptible to changes happening globally, and we believe that, you know, a stronger region, a stronger world is a stronger Qatar, and by extension, I think the Gulf views it very similarly to us. And also, when we operate with Gulf development agencies, we speak the same language, and so alignment has long stood between these agencies. And we are actually, our Director General is currently in DC celebrating the 50-year anniversary of the Arab Coordination Group, which was created entirely to coordinate developmental efforts both in our Arab region and beyond that. And so I think it's quite apt that you ask this question now, because when we look at Gulf players in the global world, we see with the retracting ODA, a lot of people are flooding to this region to cover that gap. And what they're confronted with is of course, you know, welcoming the opportunity to contribute to global development and humanitarian assistance. But they also realize that these agencies, and Qatar Fund for Development is among them, have long-standing strategic goals and outlooks for how we would like the world to be, and what our role is in integrating into the development of the world. And so I spoke briefly about Qatar Fund for Development and our strategy that recently was approved, and part of it is sustaining our pillars of support for the healthcare sector, for the educational sector, for economic reform in whatever way, or economic development in whatever way that looks like, and it looks differently from country to country. And so when we talk about our role and what we see for Gulf regions, we see more of what they're doing quite well already. We see doubling down on their leadership and initiatives that are sustainable, that are long-term partnerships, that are quite, effective in their approach. Most of the Gulf or development agencies actually have relationships with MDBs, for example, and they work through them in their projects, and Qatar Fund for Development is among them. And so the similarities between us allows for a lot of integration, and we do work quite well together in compatible and complementary developmental projects. Recently, actually, we worked with the Saudis in support of Syria, and there's so much more that we do with these agencies, either in parallel or compatibly. And therefore, the vision that we, as Qatar Fund for Development, hold for ourselves at least, is standing with the people of the world in their support and in our efforts at least, for advancing development in their regions for the betterment of that region and ours as well. And we see a lot of lessons learned, and we benefit from a lot of the aid and development projects that we do globally. And that it's investment in our own human capital and our own capabilities as a country. And so we do see this return on investment as it's said,
Thank you. I was really drawn to the Minister when she shared that investing in healthcare is investing in dignity. And you also just spoke about investing both in the health sector and in the education sector. So although we're discussing health financing today, I really want to also bring in a question about education as well. And so I'm just going to open it up, and then whoever is interested could please probably discuss a little bit about it. But really, how can the education system be leveraged to expand awareness and uptake of essential health services? So in the sense that, how can we get, in countries, for example, the ministries of education and the ministries of health working together to ensure that these investments that are being made in the populations actually lead to positive health outcomes? And okay, so Dr. V, you could start.
I can make an attempt at that from our perspective. So the development agenda of the government of Nigeria is really anchored around human capital. And that sits on three pillars, really. There is the healthcare, basic health services, access to that. There is the education, and social welfare. So in fact, necessarily, we're joined in the hip between the health sector and the education sector and have to work very closely together. What we also know is that vulnerability and inequities are very similar. So we have a substantial number of out-of-school children as a country that we're trying to tackle as quickly as we can. We also have a substantial number of zero-dose children and women that aren't reached by antenatal care and basic services. And when you overlay this on a geographic distribution, it's the same places. So it's the same children that are falling out of school, are the same children that are not getting childhood vaccines and some of these life-saving interventions. So necessarily, we are now sitting and recognizing that, in fact, for those who are familiar with Nigeria, once it became very clear the president did something that was interesting, he took the Minister of State, which is the second minister in the health ministry, and he's now the Minister of Education. You know, basically taking a lot of the things we had started in the health sector to infuse into the education sector. They are now doing their own education swap. They have their own sector renewal investment initiative and things like that. And we're working together. So we start from joint planning. You know, we're doing driving birth registration of births. We're using that, you know, we want to use that to track immunization and, you know, child health services, but we also want to use that to track school enrollment at the same time. For execution as well, for important things, many of our targets are children who are or should be in school. So in fact, as an example, the vaccination campaign that I just referred to, we worked very closely with the Ministry of Education because the girls are in school who need to receive HPV. Many children that need to be reached with the measles rubella are in schools in one form or the other. And we're using that platform to communicate to basically through the parent-teachers associations, through the teachers, but even a captive audience of the kids themselves to tell them, you know, what they need to do, but also administer the vaccines while allowing for what we call an opt-out. So a parent can vehemently say, I really, really don't want this, but unless a parent says that the child will get it, that's a policy approach we were able to secure with the Ministry of Education. Of course, one of the big issues that we contend with is that of health workers. And how do you fix that, right? You produce more, you train the ones that you have to equip them. So we're necessarily having to also do that very closely with the Ministry of Education. They've done quite a bit in revamping the curricula of the training institutions, like I said, to be more integrated and holistic. They also expanded the training capacity of our local institutions, at least approved higher numbers of doctors, nurses, midwives, community health workers to be trained. And we're now doing the grunt work to make sure that the infrastructure and the resources that they need to actually fulfill that is in place. So these are some of the areas, but I think what is clear to us is that, you know, without health, there is no future. Without education, there is no future. So we have to basically work together, yeah.
Thank you. Would you also like to come in?
Similar to what has been said, from us at the Gates Foundation, social sectors are vital. one of the first programs that got created by the Gates Foundation was our education program in the US, that then later on expanded to be international. We're nowhere near what Qatar has done at the global level of education. But also I think what we're recognizing is sometimes when we are in the health sector, we need to bring the education sector along. We're lucky in the health sector. We can show results within a year. In the education sector, it takes a generation sometimes to show results. So sometimes we're not working with the same parameters. But I think we just alluded to the vaccination of girls through the papilloma vaccine for cervical cancer. When it works well together, it's impressive what you can do. But when we don't work well together with the education sector, we can also derail some of each other's works. So I think for us at the Gates Foundation, we are starting to see how we can do better alignment on our work, but also how important it is for us in a moment of crisis to protect both sectors. Because we don't want to be, sometimes when resources become less, you start to see this competition. We need to elevate all the social sectors so we really have better generations in the future.
Yeah. Sheikh Haya, would you like to also weigh in on?
I think my colleagues covered it all, but I think an example that's always great to point at is the integration of how we work through our partners in both worlds. And a great example of that is Education Above All. Actually, through them, the project that we have with Gavi is initiated and rolled out. And that integration of partnerships in which they work together compatibly, I think is a great example of where the two worlds collide and can complement each other. But also a lot of the issues that children face, health issues, I should say, are pointed out and detected in schools, and having that ecosystem of reporting and having streams of communication open is a requirement, but also a great and sometimes life-saving avenue to have.
Thank you, and you actually answered my second question. So. Yes, the panelists have been talking, but I think I've been asking all the questions, and so I shouldn't really be greedy. So I think it's time for us to open up the question and answer session, so that if there are any questions in the audience, then we can take them now, please. Yes, I see one hand. And please introduce yourself so that, thank you.
Good evening, Salim Salama. I'm the Chief Executive Officer of the World Innovation Summit for Health with Qatar Foundation. Just going back perhaps to the title of this session on health financing in particular, we just had recently the fourth conference of financing for development in Spain, and a lot of the discussion were related to the fiscal space, and the fiscal space from a country perspective. To get ownership, most of the countries, I think we were discussing earlier this week, African country with the Abuja Declaration, maybe 3 or 4 countries across the continent have been able to meet the target of 15% of GDP. Most of them are under 5% of GDP. How do we create that fiscal space? One of the key questions to you related to the debt, services of the debt. 3.3 billion worldwide are in countries where they cannot invest for education or health because of the debt servicing. And we were discussing options in terms of financing. I think one of the core elements is how we can use debt swap, restructuring the debt, but also I think the colleague from Nigeria was referring to how do we address subsidies or taxation at the country level in order to create that fiscal space and invest more for health? What has been the option perhaps from Nigeria, but also from a cooperation agency, the use of debt restructuring or debt swapped as a modality maybe to support those countries? Thank you.
Thank you. So maybe Dr. Mee.
Absolutely. I think 2 points in your question that I will speak to. Thanks for that. I think the Abuja Declaration of 15%, I think at the time, really serves as a good indicator, as a good challenge or North Star for countries to aspire to. The reality when you put it on the ground is that, sometimes things need to be contextualized. We had a former Minister of Finance, Ngozi Okonjo-Iweala, who used to make a joke that, health sector, when we would go to her and say, give us 15%, education would say, give us 18%, power would say, security would say. She says, when you add all the percentages, it's 140-something% of the GDP. So when you take that in a vertical mindset and not contextualize it, sometimes we ask for the impossible. But the point is we need to spend a lot more, and whatever we can use as a push or levers or incentives to do that as countries, I think it needs to be done. One way, of course, is to increase the base. 5% of 1 million is not the same as even 1% of 1 billion. So while I think what we're finding more useful as a government is to think more specifically about how much do you need and how do you raise it, and not necessarily tie it to the GDP or whatever else. For example, when there was the removal of the ODA, when the US government did what happened in February, early February, because of the swap that we were doing, we were very able to very quickly quantify what we were going to lose. So we pulled all the different streams of funding, and while, for the priority programs, AIDS, TB, malaria, and vaccines at the time, both the direct PEPFAR funds and the multilateral funding through Gavi and Global Fund, it was going to sum to about $1 billion in all was at risk. But then we did our own analysis, bottom up, to say if you want to use government systems to fill these gaps and provide these services, what do you really need? As you know, many of this aid is implemented through international NGOs, lots of overhead, salary rates are different, many things. And we really saw that we could, when you adjusted for commodities that were on ground, the immediate need at the time was 1/5 of that. And it was an easier advocacy to do. The minister was able to go to the president and say, look, we would run into trouble if you don't do this for us. And so there was an intervention of the president, who approved $200 million at the time to start to fill some of those gaps. And that's what's helped us. I think I mentioned this earlier, but I want to say that while we are in, there's lots of discussions about, debt for health swap, debt restructuring, many different tools, private sector participation in health financing and all of that. There are different phases or different points of development. But in reality, the most important thing you need to do is raise more money as a government. So all efforts to improve, to expand the economy. So some of the conversations, that in fact we're having with our Middle Eastern governments around investing in the economies through FDIs, I think it would help, whatever percentage that is. All sorts of efforts as well that we are doing domestically to expand or to diversify the contribution. So let the states also put money on the table, let the local governments put money on the table, you get a bigger pool. We're trying to expand insurance. 4 million people have been added to insurance. That's not enough, but that's substantial. Those premiums are resources that are being injected into the health sector. So it has to be a multi-pronged kind of approach to try to improve health financing.
Yeah, Dr. Salim, thank you for that question. And FFD gave a list of recommendations, and among that recommendations, there are countries that are, not eligible, as you outlined, to loans, government loans, but there are other modalities in which we are able to engage with them. And leveraging on partnerships is key to us. And also, these partners are now developing their financial systems to be able to renew their resources in some way or another. So that's one track. But another thing that Qatar Fund for Development certainly is doing is supporting countries or expediting that track for graduation, getting them closer to a state in which they are able to engage with these financial instruments and help themselves push forward. So there are several ways in which we try to engage with them. But for example, Gavi has a great system, the FM system, in which it allows them to scale up their resources and mobilize it in times of need. And that's where we are looking at the next phase of engagements with our traditional partners to advance support for the healthcare system, but in a way that is sustainable and viable in the long term.
Thank you. We have a question from the audience. Maybe we'll wait for a mic, because, so Tabi. And then after that, we'll take the question from here.
Thank you very much for all the panelists for this a very useful, basically, session on Global South. My question, probably because I teach global inequalities, where I'm teaching in Hamad bin Khalifa University, when the issue of, post-aid and what we have seen recently, which is the cuts, as it was indicated with the panelists here, are we going to see a new kind of multilateral system, at least at the Global South, because there are a lot of things that could be shared in terms of the, even the indicators of inequalities within the World Inequalities Report. So when we reimagine global health financing, or we reimagine global education financing, are we really now, it's the right time for you as experts, basically, is it the right time, the right moment of history where we can see a new Global South system basically at its birth, even if it's yet beginning, but I can see something, synergies maybe. So I would like to hear from you.
Thank you for that excellent question. It's not only an opportune time or the right time, it's actually an absolute necessity at this point. I think the structures that we knew before are gone. They're just going to, the dynamic, the arrangement is going to change. It's, that train has moved. So you have two options. You can either not have a new dimension and just let things fade away and let structured collaboration, across regions of the world just collapse, or you can think about a new order. And I have to tell you that there is a lot of consideration and a lot of discussions about what a new order might look like. But what the parameters of that have to be that more and more the countries have to be at the center of it. So if you're looking at Africa, for example, African country governments need to not just be carried along, but actually be at the center of shaping it and owning it and financing it. Because what you found is that a lot of the multilateral platforms that exist today or in the past, there were nominal contributions from African governments. But if you're really going to drive ownership, of the new order, I think we need to make sure that from the beginning, the countries are at the center of it, the priorities and the approaches are contextualized, and the financing, there's also we have skin in the game, basically, I think that we shouldn't repeat the mistakes, in what is going to come.
So I would say it a little bit to what you're saying, a moment of crisis is an opportunity, and we're right in the middle of it. So I think the solutions, the frameworks, what that would look like is still to be seen. We do know that, for instance, from the health sector, and you allude to the International Finance Facility for Immunization, has usually come with very creative solutions. We had UNITAID with an airline tax that in its moment created new revenue. We had the advanced market commitment, which was a pull mechanism. So there've been a lot of thinking in the past. And I think with the new tools, with the new solutions, we are going to find what we need. It's not going to look the same. At the same time, I'm originally from Mexico, so I remember when I was younger that a lot of the donors pulled out of Latin America. And it was, I have to say, it was about 5 years of shock on balance, not knowing where to go. But eventually the countries found their way. And sometimes if you look at the Latin America region, a lot of the people look at what's being done in terms of health and our populations. We still have challenges, but we're still moving ahead. The other thing I think for us is really important. From the philanthropic side, we are trying to find new solutions. The Giving Pledge from the Gates Foundation is encouraging high net worth individuals to step up. You're increasingly seeing more concentration of wealth, that they can become future philanthropists. So I think also, please hold us accountable wherever we can, but let's support the countries in this new model. And also, I do encourage you to meet some of the other country attendants here, colleagues from DRC, from Pakistan and everything. What they're doing, it's amazing. And they might not have had the same power 20 years ago. They know what they want. They know how to do it. They know how to take it forward. So it really asks for us to support it and let them lead the way.
Thank you, and thanks for your patience. We're slowly rounding up now. We'll take the question from, we had a hand here. Oh, okay, we have even, okay. It was, okay, after that we'll come to you, yeah.
Yeah, thank you. I'm Dr. Suhail Al-Khidr, Director of Reproductive and Perinatal Health at Sidra Medicine. So I'm leading the maternal and child health in Sidra Medicine. I'll be shifting gears here and talking about research funding. So my question to the panel is, what do you think is the best funding model to support research, given that we all agree is so important to support clinical care decision? And how can we make sure that the funding for long-term research, like maternal and child with long-term follow-ups, doesn't run out and research remains well integrated with the clinical care? And if you have any successful model to share with us, please do. Thank you.
I think, Magda, you'd start with that.
I can try. So I have to be honest, one of the most challenging is to do resource mobilization is research and development at the Gates Foundation. And we are one of the donors that invests most in the space. We do have some initiatives, those of you that are CEPI, and I always get the acronym wrong, but it is Building for Research for Pandemic Preparedness. It has been one of the most successful experiences that we have. We are also seeing other types of research outside the health sector. We heard from one of your colleagues, your Innovation Fund for Africa, of what the ideas are coming, how do we find? So I think there's different ways that we can find it, but I have to tell you, I do think we have an uphill battle in what we do, but those of you that believe this is an important issue, we need advocates to tell us the needs, show the results, show the impact of what research can do, and for those member states that are able to do and provide funding for research, it is important to keep this issue on the agenda because our future is dependent on the solutions and thinking that we do today for the years to come. So super important. I'd be happy to put you in touch with our team that does research for maternal and child health afterwards if you grab me, and then you can also ask them some of the questions because they might be able to give you a little bit more information on maternal and child health than I can do.
I think, if I may?
Yes, please.
I think part of the reason why it's a bit more difficult to galvanize resources and interest in research is in part the way the research is formulated, whose agenda, who owns the research agenda as well. You know, I think incredibly important tools and products have been developed that have saved millions of lives. But sometimes what you find is the fact that something is great and important doesn't mean that's what is the perceived need or the immediate need of the countries. You know, I'll just give a very practical example. In my instance, I had this debate with a friend who's from a development community, and I said, look, I've got this was 2023, I've got a 53% Penta 3 coverage. That's the best I have done in my immunization program. I've got 12 vaccines in my national EPI program, and I've got this astronomically high under 5 mortality rate. You know, a third or more of that due to vaccine preventable diseases. So I'm not vaccinating half my children. So what do I prioritize? Is it delivery approaches to reach more children, or is it new, more effective, more advanced, more costly tools that I will then deploy on the same existing approach and still reach less than half the children? You know, when you know that in fact, for you to be able to get the impact from these tools, you need upwards of 80% coverage. So many times, these are the conversations that we don't have in prioritizing what the research should focus on. And I think the more, similar to my earlier comment, that we contextualize things and make sure that we're focusing research on the actual needs of the end users, I think it becomes more, there's a better business case to prioritize focus and resources, you know, in the research.
Thank you. So we have one, yes, please, we have the question from here. And then Okay, so we have one question here, we have one at the back all the way there, and then over there. And then we soon have to round up. Please,
Hi,
question.
I'm Noor Al-Thani. I'm a student in Georgetown University, and my concentration is actually on international development and sustainability. So my question links to how can we adapt these models to incorporate indigenous knowledge systems and the people's ways instead of being sidelined by top-down agendas that are enforced. I know we've touched on ownership and agency a lot, so I just wanted to expand on that.
Who'd like to? Okay.
I guess. So I think it's what I was saying. So this is at multiple levels. There is making sure that the end users in terms of the countries are involved in decision making, but even beneath that, the communities themselves. What we are finding is even within a country, within a health system, you know, when I sit in my office in Abuja and make certain priorities and make certain decisions, and that may or may not be relevant to the woman that I'm trying to reach in rural Borno or somewhere else. So the more that we have a long-term partnership with the NTLC. I think many of you would know the Sultan, His Eminence, the Sultan of Sokoto, who heads the Northern Traditional Leaders Committee for Primary Health Care. That's why this was convened several years ago, and we try to bring in the voice of the community so they understand what the objective is. We also hear from them what's working, what's not working, and what would be ways to reach them. And they've been incredible in addressing some of the demand side issues. It's not all solved, you know, that we've had. Yeah.
So I think we'll take one more question. You've all been a great audience, but we also have a reception, so there'll be time for us to sort of engage outside as well. There was a hand all the way at the back. Yes, please.
Good evening. I'm Igor Mikalezek. I several hats or beret in French. We have an organization, Meals on Wheels. We provide support to alleviate child birth, health issues for maternity and all. But I have another question. It's because it's very interesting because we go back to the global south and solidarity in the global south, and how can we involve the civil society, diaspora, in helping finance, in supporting the development of global health in the global south. Because the government are there, foundation are there from the north. Qatar can play a very interesting and important role. But what about the diaspora and the civil society in this?
Thank you for the question. So diaspora and civil society, how can they play a role?
I think very, very important question, because many of our countries in the global south basically are contributing workforce for the health systems in the north, and to some regard even in the Middle East. I remember several years ago, my father had come to spend some time working in one of the Middle Eastern countries. He was a surgeon. That trend hasn't stopped. I think it's very important that people are able to go and practice and get the experience and the expertise and the training. We all did. I also trained in the US before I moved back to Nigeria. But I think what is also important is that we create low-cost, easy ways for the diaspora to be able to give back. Many of them want to contribute, but the disconnect between where they are and their responsibilities and the mechanisms, platforms that we have on the ground is so big that you have to really sit around a table as a collective of stakeholders, the diasporans themselves, the new host countries, to think about, are there innovative approaches? Can you systematically give back some of your time, as a contribution in kind? We've talked about a few of this. We have a diaspora commission that is working on this, and we do little things here and there. But this is something that I've given some thought to myself, because I fall in that category in many different ways. And You know, if you can keep your job in, you know, Doha, for example, at Sidra Health, the CEO is a very good friend and a Nigerian. So if you can keep your job there, but through a structured arrangement, you can give 2 days a month to do specific things, especially around training. You know, you may not be able to operate a practice or things, but I think there's a lot of capacity that you get from practicing in some of the more advanced countries that are now lost, you know, in the base. And everybody wins, because then we can produce more, there's more capacity, you guys can hire them when you need more, and then they can give back some more, you know? Everybody wins. But I think we need to have like real conversations. This doesn't need to be a drag. It can in fact be thought of as an opportunity, but everybody needs to be honest and sit around and talk about ways to make this work. Yeah.
Okay, thank you. Quickly.
So there was also the part of civil society. So for us at the Gates Foundation, we believe civil society is a crucial stakeholder for us to advance a development and health and education agenda. So we support civil society in numerous ways. In health, a lot of our funding goes to the Global Fund, to Gavi, to GPI. So they have allocations for civil society. They're working in coordination with governments, and we do hope that they're doing that, because sometimes when civil society goes on its own, it can be very helpful to reach the most vulnerable communities, but you also have to be working in coordination with the leadership, because we don't want to create pockets on inequities as we move forward. So for us, civil society is also an amazing partner. Their voices, their convictions, the advocates, the champions are really elevating us and keep us accountable in many of the settings. So we cannot do this alone. Civil society is an integral part of all of our work.
So I know I said it was the last question, but I've been getting smiles, but we'll just have to take, yes, we'll take that, but can you both do the questions, you and you as well? Just ask the questions, then we'll answer.
Yeah,
so that we can,
my name is Dr. Fuad Hassan.
Thank you.
I'm a public health professional affiliated with a local NGO in Qatar. There has been a lot of discussion recently on Islamic social finance in addressing the United Nations SDGs. Now, is this something also which can be explored in addressing the global health financing, especially in Muslim countries, and the role of the private sector, which can be tapped on this? Thank you.
Assalamu alaikum. I'm Dr. Abdulrahman Al-Gashana from Kuwait. I'm the Eastern Mediterranean Region Coordinator for WHO. As the esteemed colleague here spoke about the multilateralism and the new multilateralism, I think in May the international community has succeeded the pandemic agreement. This is a new treaty that make solidarity for the global community. And as we now negotiating on the PAPS Annex, the operational plan of this new treaty, to overcome the fatality mistake that we faced during COVID-19. And the question to the panelists, as Qatar is the largest contributor to the global community during the COVID-19, and also the Gavi Foundation as by Gates Foundation, how can you see that equity can be embedded from your view to this new multilateral system as an operational framework, and how we move from the short-term action for the countries in need to a resilient system, funding system, as for the largest contributors, Qatar and the Gavi Foundation? Thank you.
Yeah, I'll touch upon the second question, of course, first. I believe I mentioned this in my previous intervention, which is we approach things, in a multi-year approach and process, and that maybe addresses the sustainability element of things. Equity, and that's a whole other, issue that we grapple with, because equity is a real problem that most of us try to address in ways that are that ways that are disseminated, ways that are where we're able to see that big impact seen, and it's I think it's a negotiation back and forth, and it's very difficult. And we look at the research, we look at people who are on the ground who feed into where the needs are. We can't do things in silo, and we can't do things from, our as the Georgetown students have mentioned, top down. We really do need to be fed from the bottom up. What are the needs and how we can effectively address things. And of course, working with partners and being able to scale up our contributions is also key to that. Because, especially with the retracting ODAs, what we saw is a lot of agencies were addressing or, giving their grievances about sustainability. But having multiple donors, having multiple agencies come together, here is where the balance is, and here is where you can establish sort of the longevity of these projects. But I don't know if the Gates Foundation has anything.
So we're not a member state, so we have a different role to play. I think from us, the support is financial, technical, some of the work that we've done in the past. But equity is a principle of our vision, our foundation, and we tried whenever possible to take that forward. So I think I'm going to leave it at that, because I know we're close to time and we need to, there was how do we work with Islamic
Islamic
financing. At the Gates Foundation, one of our most innovative, successful partnerships have been here in the region, but also with the Islamic Development Bank. So I'll be happy to share with you, and I have one of my colleagues that's more familiar with our partnerships there to give you some examples. But I have to say, they're very generous partners and donors, and we have a lot to learn and share with you. Thank you.
On that note, I'd like to say thank you to you all. Our panelists today have really been super, contributed richly to the discussion. And really what we've heard today underscores both the urgency and the opportunity before us. So the urgency of protecting essential services under these tightening fiscal conditions, and the opportunity to really reimagine health financing. Today's discussion has showed that even in times of shrinking resources, countries can chart new paths through innovation, integration, and strong partnerships. What matters most is that solutions remain country-led and equity-focused. Qatar, as we close, it is important to recognize Qatar's role as a convener and partner in advancing a more resilient and country-led global health financing agenda. And the Doha Global South Health Policy Initiative will continue to build on today's discussions, today's dialogue, ensuring that the insights shared here translate into some action across the regions. Thank you all for your contributions. We look forward to continuing this important conversation. We can do that today outside because we have a reception as well for you, or in the future. Thank you very much. Thank you.